Dear students, welcome back. In the previous session we have discussed about ossification of the hip bone. Now in this session we are going to discuss about another long bone which is related to the thigh region, that is femur. So normally the femur, the word is derived from Latin, and the femur means thigh or thigh bone. So this bone is the longest and the strongest bone of the body. Like any other typical bone, it also possesses two ends. One is the upper end, lower end, and shaft. Okay, how can you determine the side of this bone means? So normally the upper end bears a rounded head, whereas the lower end is expanded to form two large condyles. The head is directed medially and the shaft is cylindrical and it is convex anteriorly. So by or anteriorly or convex forwards we can say. So by all these features we can determine the side of the femur. If we see the anatomical position, the head is directed medially upwards. Here the head is directed medially upwards and forwards. Okay, and the shaft is directed obliquely downwards. So here if you can see the shaft which is directed obliquely downwards and medially, so that the lower surfaces of the two condyles of the femur lie in the same horizontal plane. This is the anatomical position of the femur. Here if you can see this bone is related to the right side, that it is right femur. We are seeing the anterior aspect of the right femur, and this one is the posterior aspect of the right femur. Okay, yes. Now we will discuss about the features. Okay, already the bone is divided into upper end, lower end and shaft, isn't it? Yes. Now we will discuss about the upper end. The upper end possesses head, okay, neck, and it is having greater trochanter and lesser trochanter. So these are all the parts which related to the upper end of the femur. Okay, what are those? Head, neck, greater trochanter and lesser trochanter. And also over the head, okay, head of the femur, on the medial aspect, this almost appears superiorly. It will have a pit-like projection called fovea. Okay, now so here, and also here we have to observe one line which is present in between this greater trochanter and lesser trochanter, that is called as intertrochanteric line. Okay, and also it possesses intertrochanteric crest. So that crest we can see on the posterior aspect very clearly. This is the intertrochanteric crest. Okay, yes. Now we will see the head in detail. The head forms more than half a sphere and is directed medially upwards and slightly forwards. So I have mentioned in the anatomical position, and it articulates with the acetabulum to form the hip joint. A roughened pit is situated just below and behind the center of the head. This pit is called as fovea. Okay, and this head lies within the capsule of the hip joint. Okay, now we will see neck. The neck is about 3.7 centimeters long. It connects the head with the shaft, and the neck has two borders, okay, and two surfaces. So the upper border, so this becomes the upper border and this becomes the lower border of the neck. Okay, the neck has two borders and two surfaces. One is the upper border, which is concave and horizontal, meets the shaft at the greater trochanter. So we can say this thing and this thing. Yes, this is the upper end, but it is seen in the posterior medial view. Okay, so here we can see the neck, and which is having upper border and the lower border. So the upper border is concave and horizontal, meets the shaft at the greater trochanter. The lower border is straight and oblique and meets the shaft near the lesser trochanter. Okay, so here this one is the posterior surface actually. The anterior surface is flat. It meets the shaft at the intertrochanteric line. Okay, it is entirely intracapsular. That means the anterior surface of the femur lies inside the capsule. Okay, the articular cartilage of the head may extend to this surface. Now coming to the posterior surface is convex from above downwards, okay, and concave from side to side, It meets the shaft, so the posterior surface meets the shaft at intertrochanteric crest. Here we can see this intertrochanteric crest. Okay, so this is the greater trochanter, and here you can observe the lesser trochanter and the posterior side very minimal. So here this one is the intertrochanteric crest. Okay, so only a little more than its medial half is intracapsular. Okay, now so this neck joins the head to the shaft, and it is forming an angle of 125 degrees. Okay, so this wide angle is known as angle of inclination. So this is the angle of inclination, which is making an axis which is drawn from head and neck, and which cuts the longitudinal axis of the shaft of the femur, makes an angle of 125 degrees. This is called as angle of inclination. Because of this angle of inclination, it enables the lower limb to move clear of the pelvis. Normally this angle is less in females. Okay, so this is about the neck of the femur. Now we will see the greater trochanter. So this greater trochanter, if you can see, this part is the greater trochanter. The greater trochanter is a large quadrangular prominence which projects upwards from the junction of the neck and the shaft. Its posterior superior parts projects upwards and medially beyond the level of the neck, so as it overhang it, and it possesses three surfaces and one border. So this one possesses three surfaces and one border. What are the surfaces means? Here we can see the anterior surface. On the lateral side we can see lateral surface, and another one is the medial surface. So this is the trochanter, greater trochanter. So this one is anterior surface, lateral surface and medial surface. So the anterior surface is rough and irregular. Okay, normally if it is irregular means it is giving some muscle attachments. Okay, if you see on the lateral surface, it faces laterally and separated from the anterior surface by an indistinct ridge is present which separates the anterior and lateral surfaces. Okay, on the lateral surface, it has an oblique ridge is present on this surface. So on the lateral surface also it is having an oblique ridge. Here again we can see, so this is the lateral view. Here this is the greater trochanter. So on the lateral aspect it is having an oblique ridge. So this is the oblique ridge, okay, which is present on the lateral surface of the greater trochanter. Okay, and next coming to the medial surface. So here we can see the medial surface. Okay, this forms the medial surface. It has a depression called Trochanteric Fossa at its posterior inferior part. So this is the posterior inferior part. It is having a depression called Trochanteric Fossa. Okay, normally in this fossa, some of the muscles are inserted. So we are going to discuss in the muscle attachments. So first you should know the trochanteric fossa. Okay, now it is having only one prominent margin, that is called as superior margin. It is a prominent margin. Normally in this margin another muscle which is going to attach here. So here the greater trochanter is going to give attachment to many muscles. Okay, now this greater trochanter, which is a quadrangular prominence, which is having three surfaces and one border. One is the anterior surface, lateral surface, medial surface, okay, and one border, that is superior border. Now we will move on to the lesser trochanter. It is a blunt conical projection. Okay, so here we can see on the lateral aspect also we can find this lesser trochanter. Okay, and we will move on to again anterior and posterior aspects. We can find this lesser trochanter here. Okay, here you can see this lesser trochanter. This is a blunt conical projection at infero-medial part of the junction between the neck and the shaft. It faces medially as well as backwards. It faces medially and backwards. Okay, and this one is also giving insertion to two muscles. As you people know, the two muscles are iliopsoas. Okay. Next, we will see the intertrochanteric line. So this intertrochanteric line, it is a rough oblique ridge placed at the junction of anterior surface of neck with shaft. Okay, this is called as intertrochanteric line. Okay, next. Below it is continuous with the spiral line. Okay, the spiral line we will see in the shaft. Okay, and this one is also giving attachments to two muscles and two ligaments over this intertrochanteric line. Now we will see the intertrochanteric crest. So this on the posterior aspect we can find the intertrochanteric crest. It is a smooth rounded ridge placed at the junction of posterior surface of neck with the shaft. And in the intertrochanteric crest, so quadrate tubercle is present, which is a low rounded elevation in its middle part. In its middle part of the intertrochanteric crest, we can find this quadrate tubercle. So again we will see on the posterior aspect we can find this quadrate tubercle. Yes, this is the quadrate tubercle. Okay, yes, and normally this quadrate tubercle is also give attachment to one muscle. Okay. Yes. Now we will move on to the shaft of the femur. Yes. The shaft is narrow opposite to its middle part but expands at its upper and lower parts. If you can see the bone, so the upper parts are somewhat expanded and the middle part is narrow. Okay, and this shaft possesses three borders. So lateral, medial and posterior, and also surfaces or four surfaces. So in its upper and lower thirds, but only three surfaces in its middle third. Okay, so the shaft possesses lateral, medial and posterior borders, three borders, and surfaces at the upper and lower thirds. It possesses four surfaces, and in its middle it possesses only three. Now we will see. Okay, now we will see the borders of the bone. So the borders are lateral border. Okay, you can find here the lateral border, medial border, and you can find the posterior border. Okay, on the posterior aspect. So the lateral border is rounded and ill-defined. It separates anterior from lateral surface. So this is separating anterior from lateral surface. If you see the medial also rounded and ill-defined. It separates anterior surface with that of the medial surface. If you see on the posterior aspect, so it is having a linea aspera. Here also we can see the medial border, and this one is lateral border. Okay, and here at the middle you can find here a spiral line is present, and this one is the linea aspera, and it is having medial lip as well as lateral lips. So here at the lower aspect you can see the separation of this linea aspera very clearly. Okay, so on the posterior aspect we can find the posterior border called as linea aspera. It is thick roughened crest opposite the middle third of the shaft. So middle third of the shaft we can find very roughened structure, and this one possesses medial lip and lateral lips. Okay, and an intermediate area is present. Okay, these two lips diverge from each other as they are traced above and below. So if you traced below, these two lips are separating, and also in the upper part also this one can be separated, appears to be separated. Okay, the medial lip is continuous. So here if you can see the medial lip of linea aspera, which is continuous with the spiral line of the above part of the shaft of the femur, and below it is continuous with the medial supracondylar line, while the lateral lip is continuous above with the gluteal tuberosity. So here you can find above the gluteal tuberosity, and below it is continuous with the lateral supracondylar ridge. So these are all the borders of the shaft of the femur. Now we will see the surfaces. So normally it is having four surfaces at upper and lower thirds, but at the middle it is having only 3. So how it appears means here, so if you make a cross section of the bone, so this becomes the posterior part, this is the linea aspera, and this one becomes the lateral border, and this is medial border. Okay, and this linea aspera is nothing but posterior border. So this lateral border and medial border. So this lateral border separates, okay, anterior surface. So normally if you can see, the anterior surface lies between lateral and medial borders. This becomes the anterior surface, and this surface is smooth and convex. Okay, and coming to the lateral surface, it lies in between lateral border and the posterior borders. So this becomes the lateral surface, and it faces backwards and laterally. This surface faces backwards and laterally. If you see the medial surface, it lies between the medial border and the posterior borders. Okay, it faces backwards and medially. So these are the 3 surfaces. Okay, if you see on the upper posterior, so on the upper 1/3 and lower 1/3, it is having 4 surfaces, isn't it? So the 3 borders are as usual, 3 surfaces are as usual in the upper part also, but there is some difference on the posterior aspect. So the upper posterior lies between the spiral line medially. So as we know that this is the spiral line medially, and gluteal tuberosity. So in between spiral line and gluteal tuberosity, you can find this upper posterior surface. Okay, in between spiral line and gluteal tuberosity. Okay, yes. Now if you see in the lower posterior, it lies between the medial and lateral supracondylar ridges lines, which are continuous above with medial and lateral lip of linea aspera. Okay, so this is about the features of the shaft of the femur. Now we will move on to the lower end of the femur. It is broadly expanded. So the lower end is broadly expanded so as to provide a good bearing surface for transmitting the body weight to the next bone, that is which is present distal to the femur, that is upper end of tibia. Okay, it consists of 2 prominent thick masses of bone. So it consists of thick masses of bone. You can see on both the sides. So these are called as condyles. One is the medial condyle and lateral condyle. Medial condyle and lateral condyles. Okay, and these condyles are separated from each other by intercondylar fossa or notch, we can say. On the posterior aspect we can see the intercondylar notch. Okay, yes, we will see the lower end separately. Yes, so this is, you can see this one is the medial condyle and lateral condyle, and these two are separated by intercondylar notch. Okay, now it has 2 articular surface. One is the patellar and tibial articular surfaces. So here you can find the area for patella articulations and also tibial articular surfaces. So these 2 condyles will articulate with the articular surfaces of the tibia. Okay. Now we will see the lateral condyle. The lateral condyle comparatively, which is smaller but stronger than medial condyle. Here we are seeing here is the lateral condyle here. Okay, and this lateral condyle possesses an epicondyle called as lateral epicondyle. So here you can find this lateral epicondyle, which is a low rounded elevation on the lateral aspect. Normally it gives attachments to the ligament, and there is a groove between the epicondyle and articular margin. Okay, so that groove is called as here two grooves are present. One is posterior and anterior grooves are present. Normally these grooves helps in the attachment. Normally the anterior groove gives attachment to the popliteus muscle. Okay. Its medial surface forms lateral wall of the intercondylar fossa. So this lateral condyle medial side forms the lateral wall of the intercondylar fossa. Okay. Now this is all about the lateral condyle. If you see the medial condyle is more prominent than lateral condyle, and it is having having a medial epicondyle, which is a low rounded elevation on the medial aspect and lies below and a little in front of adductor tubercle. Actually this adductor tubercle we can find here. Yes, here you can find the adductor tubercle. So at the lower end over the medial epicondyle, this is the adductor tubercle here, and below this adductor tubercle you find medial epicondyle. So this adductor tubercle is a small projection at the uppermost part of the medial condyle. Okay, yes. So these are all the features which are present in the lower end of the femur. And this intercondylar fossa or notch, it separates the two condyles below and behind, where it is limited by the intercondylar line. This line separates the fossa from the popliteal surface. So this fossa separates this line separates the fossa from popliteal surface. It lies within the capsule. This intercondylar fossa lies within the capsule of knee joint, but to a large extent it is extrasynovial. Normally it gives attachments to the knee ligaments such as anterior and posterior cruciate ligaments. Okay. So these are all about the bony parts which are related to the femur. In the next session we are going to discuss about the muscle attachments. Thank you.